Jesus, when he was on earth, he showed how health care should be handled. He told his disciples, you receive free, give free. They were given the ability to heal others freely. They were to do it freely to others. And so Jesus was showing that health care under God's kingdom is free. It's not to be charged. God's kingdom is not about charging people for health care, but it's really a national health care program. But imagine if Judas could have stood at the door charging. With his greedy self, he would have brought in all kind of money. He'd be saying, asking, okay, what you got, what you need healed. Then he'll look up his book, well, that's going to cost you this much. Oh, Judas would have loved that. That was not to be the case. Jesus healed people freely. And any government or kingdom rulership by humans that fall into this pattern of giving free health care, a national health care program, fall into the same thing that Jesus was doing. They can't be as effective as Jesus, but they will still fall into that pattern. Notice the account of the Good Samaritan. In verse 30 it says, then Jesus answered and said, a certain man went down from Jerusalem to Jericho and fell among thieves, who stripped him of his clothing, wounded him, and departed, leaving him half dead. Verse 31, now by chance a certain priest came down that road, and when he saw him, he passed by on the other side. So this priest is supposed to be spiritually charged, but even he didn't want to be bothered. Verse 32, likewise a Levite, when he arrived at the place, came and looked and passed by on the other side. He too was supposed to be spiritually charged as a Levite, one serving in the temple, but he didn't want to be bothered. Verse 33, but a certain Samaritan, as he journeyed, came where he was, and when he saw him, he had compassion. And so he went to him and bandaged his wounds, pouring on oil and wine. And he set him on his own animal, brought him to an inn, and took care of him. On the next day, when he departed, he took out 2 denarii, gave them to the innkeeper, and said to him, take care of him, and whatever more you spend, when I come again, I will repay you. So which of these 3 do you think was neighbor to him who fell among the thieves? Verse 37 said, and he said, he who showed mercy on him. Then Jesus said to him, go and do likewise. Did he go back and say, hey, I gave you 2 denarii to take care of you. Can you get my money back? No, he didn't do that. He said, whatever I owe you, if you're going to pay more money while this guy is here and I'm gone, when I come back, I'll give it to you. He wasn't looking for payment back. He was saying the man needed help, that's what I did. But this is what the world, they may have Good Samaritan hospitals, but ain't nothing Good Samaritan about them prices, are they? See, this is what God, his viewpoint of health care. It's not a matter of how much money can we get out of you for something where you're in need, but it's about taking care of the need and bringing people to a healthy resolution of the situation. That's what it's about. But when governments go around slashing support for those who are in need of health care, then they run afoul of what Jesus was saying here, of how when people are in need, that's where you're supposed to be. You're not supposed to be looking to be charging them all this money for health care. And because of their greed, even the health care they provide is kind of like the woman who touched Jesus because she had a flow that would not stop. She had spent all her money and she was getting no results. But she said, if I just touch Jesus, this will stop. My medical situation will be resolved. And she did touch him, and her faith, she was healed. And so because of the greed, people go from doctor to doctor to doctor. And all they're getting is being drained of their money, and they're not getting a resolution to their medical situation. Because it's about capitalism, about getting that money. It shouldn't be a system where people are being drained of their resources. It should be a system that focuses on resolving healthcare situations, not about profit. That is a true Good Samaritan hospital. That is a true listening to what Jesus was saying about the Good Samaritan. People say, well, them foreigners, they come in this land and they're taking taking advantage of the health care and all this kind of thing. Well, if we're thinking in terms of what Jesus is saying here, we're not going to worry about them. We don't care if they're a foreigner. Look at the Samaritan. He didn't know that man. He not only took care of him, he spent money to help him. So when people start talking about, well, these foreigners or this person over here is getting advantage of these health care, they don't have the mind of Christ. But this shows you what God's kingdom is about. It won't be about all these insurance companies. It won't be about co-pays and signing up every year to see which insurance company is going to take advantage of you. No, it's just going to be about, you need to be healed. There it is. It's done. Like Jesus told the man that came to him and said, well, Jesus said, what do you want? He said, well, I want to see again. Jesus said, well, see again. Be as simple as that. But humans, they're so greedy and so uncaring. They have no compassion like the Good Samaritan, that if they're going to do something for you, oh, you're going to get charged. They're not thinking as Jesus how the sick need care. They're thinking that the sick means opportunity for making money. So they're therefore not really looking for the cure or to do the ultimate best. They're looking for where the profit is, how to keep you stuck on this or on that so they can keep getting money. So it's a failed system altogether. But we do what we can with the healthcare system we have, but we know that's not in line with what Jesus says should be done. And when nations have national health care programs, they're moving closer to what Jesus is saying. But to be all the way there, the profiteering has to be gone. And the zeal for working hard to curing medical situations must be there. The only real cure is going to come under the rulership of Jesus Christ, which will happen during 1,000 years, where not only people will be healed of their various illnesses, but even the cure for death will be brought forth.